Yeah, good evening. I'm pleased to be here to present this research work that the Institute of Human Virology Nigeria was able to do in Nigeria in this second Artificial Intelligence in Infectious Disease Workshop 2025. We are pleased to present our work. My name is Daniel Joseph. Alongside other authors who participated in this work. The title of our work is Efficiency Gains from the Utilization of AI-Powered Tools in TB HIV Program Implementation in Nigeria, a case study of the EPCON and IM250 apps. As a way of introduction, this will be our agenda, our background, methods, results, conclusion, and then the acknowledgement. Nigeria faces a dual burden of TB and HIV that affects large chunk of the population, particularly the vulnerable population, including pregnant women and adolescent girls and young women. Our programs are constrained by a triple optimization challenge of accessibility to communities that are unreachable. We are also constrained by limited program resources and then delayed data insights coming from these communities. Can artificial intelligence be a transformative lever? That's not just an incremental tool to overcome these challenges. Yes, we believe so. And that's because in IHVN, we have been able to leverage the power of AI tools to improve our program performance. Therefore, this study presents this evidence of AI solutions such as EPCON and IM250 is able to improve efficiency, coverage, and then the outcomes in our programs in difficult to reach environments. This is a map of Nigeria showing our implementation scope. We implement across the 36+1 states in Nigeria for TB and pregnant women case finding, while for HIV we implement in 4 states that we call the end-to-end states. On the middle picture, we have an EPCON mapped hotspots of Nigeria as a whole, showing hotspots where we are able to get this targeted population of pregnant women and adolescent girls and young women for TB and HIV case finding. While on the right, we have a snapshot of the IM250 dashboard, which is a management tool that enables us to do our implementation. So for EPCON, which is the epidemiological control platform, it functions as an AI-powered tool that helps us in mapping hotspots where we are able to go test pregnant women and adolescent girls and young women while efficiently utilizing the limited resources such as test kits that we have on our program. It is able to predict this underserved population and guides healthcare workers to these subpopulations that are vulnerable to HIV and TB. While IM250 platform, which is a management tool for us, helps us to guide our program performance and helps us take absolute decisions that are key to improving program performance. The methods we use in this study, this was a quasi-experimental pre and post analysis that was done using our program data. We were able to overcome co-founders by ensuring that we weren't having other interventions happening simultaneously during this time period. For EPCON, we were able to use this platform to reach 89,053 beneficiaries who are pregnant women and adolescent girls and young women. Data was compared in our pre-implementation between the period of May to July 2024, and then the post-implementation spanned May to July in 2025. We use statistical analysis of using chi-square to test for the categorical outcomes in these studies, and our data was analyzed using Python. For M250, this enabled us to analyze data from 260 healthcare facilities across 3 implementers. The same time period spanned across the entire project, and we were able to use descriptive statistics and Whitney U-test and t-test to test our inferential statistic. These were the results that we got from the field across the EPCON and M250 platform. We evaluated these two and had a deep dive into the methodology that were used in the field. So for EPCON, comparing data from 2024 and 2025, we see that in 2024, during that time period, 50,743 pregnant women were reached without the platform, while in 2025, same period, we were able to reach 89,053 pregnant women, giving us a 74.5% increase in pregnant women. For now, we screened for TB, we were able to screen 47,601 in 2024 without the platform, and then there was a surge using the platform, giving us 86,243 pregnant women that were screened. This, of course, gave us a 96.8% improvement as against the 93.8% without the platform. So this also improved our TB yield from 3.2% to 5.9%, and then confirmed cases scaled up from just an abysmal 2 in 2024 to 277 TB case finding recorded. For M250, our numbers improved by over 490.5%, as you will see, for AGYW tested for HIV, and about 887.9% improvement for AGYW that were reached with preventive interventions in our states of implementation. M250 also helped us to reduce our monthly meetings, helped us increase compliance in reporting across board, and build capacity of staff on the program. This is a snapshot that shows how EPCON is used on the program, helps us to, as you see on the map, to identify hotspots where TB is prevalent and there are pregnant women that need testing to be done. And then this data is transcribed to healthcare workers for them to be able to test these pregnant women and find AGYW in the communities. In conclusion, AI presents an opportunity to improve public health programs and has the ability to transform programs, enhancing service delivery to underserved populations, including adolescent girls and young women, as well as pregnant women in communities that are inaccessible. Our preliminary results from the field shows great evidence that AI-driven solutions like EPCON and M250 are enhancers of efficiency and productivity in healthcare delivery. We therefore recommend that AI be leveraged in public health care program. For us in IHVN, we are futuristic and are leveraging the power of AI and tech solutions in our program to enhance our efficiency gains. For the future priorities and prospects of the use of AI in public health, we are recommending that in the future, AI be used to automate routine tasks of healthcare workers in our programs, and also to help in predicting the stockout of rapid test kits as well as drug in healthcare facilities. We are also we'll be leveraging AI to personalize service delivery for clients in these communities, and therefore also moving from being reactive to proactive in the use of AI to predict disease patterns across populations and these key vulnerable populations. We are also leveraging AI to decentralize service delivery to clients in these communities. This is a conflict of interest disclosure. So participants and authors in this research were supported by Global Fund on our program implemented on the GC7 entry grant. EPCON and AIM 250 were developed respectively by EPCON and NH, and therefore the authors discloses that IHVN and all its partners have no financial interest or in the promotion of the commercial success of these tools. Our interests are solely for public health impact. We acknowledge the federal government of Nigeria, the Global Fund for supporting our program, the Institute of Human Virology of Nigeria that is implementing these programs through partners like ECUS and SFH and the Federal Ministry of Health through the regulatory bodies like NACA, NASCAP, and NTBLCP. Thank you very much.